Thank you. So I'm going to do a presentation on palliative drug interactions with their complementary alternative supplement use in the Sacramento community specifically. I have a poster out in the hallway, and this presentation is basically going to be a presentation of that poster. So really what I did is if surveys are going to go out to the palliative care community at UC Davis, the VA, also Kaiser, collecting what are patients using as far as complementary alternative medicine. And then we're using that survey to kind of run drug-drug interactions with common palliative care drugs and the interactions that I found. I also had, in addition to surveys, made local calls to all the Sprouts, Whole Foods, all the mom and pop shops, the supplemental herbal use in the community to figure out what is the community buying. So that's where this is where my research was starting for this year. So in introduction, there's an NIH national surveys indicate that more than 30% of adults use healthcare approaches that are not typically part of conventional medical care, or that they may have origins outside of the usual Western practice. So that equates to approximately 72 million adults reporting some sort of complementary alternative medicine CAM therapy. And then of that research, herbal dietary supplements are the most popular form of CAM. And I'll be using CAM in replacement to saying complementary alternative medicine. So why do we care? Treatments involving dietary supplements could have potential interactions with prescription medications and have a negative impact on patient outcomes. And despite these safety concerns that might be there, studies indicate that patients may not discuss their CAM use with their physicians. So as far as terminology, a lot of the community will use these terms interchangeably, but truly complementary means a non-mainstream practice used together with conventional medicine. Alternative medicine means a non-mainstream practice used in place of conventional medicine, and integrative means coordinating conventional and complementary medicine in an evidence-based manner. So here is an infographic produced by the NIH, says the 10 most common complementary health alternative approaches in adults in 2012. There is, NIH does these surveys every 5 years. I'm still waiting for the new results to pop up, but what they've been showing in the past, I think these surveys began in 2002, is that natural products, right up here at the top, lead the CAM modalities of what patients are using. So there are other modalities patients are using for CAM is deep breathing, yoga, tai chi, chiropractic or osteopathic manipulation, which I practice, meditation, massage, special diets, homeopathy, progressive relaxation, and guided imagery. So based on this, I see a question. Reiki, I think I would put under probably yoga, tai chi, or qigong. I mean, I practice Reiki as well, so I'm maybe be a little offended with you, but Reiki would be part of this energetic, maybe spiritual, hands-on practice, along with healing touch. So that's where, and so based on the data of receiving for the NIH, supplements, herbals seem to be the top therapies. So that the question in my mind was, how does that interact with the medications we're prescribing? And this is a great resource everyone can use that I used. It's naturalmedicines.therapeutics.research.com. It is a subscription website, but if you go to the UC Davis library, you can log in as a guest. And so this website literally has all the data, not all the data, a lot of this website's trying to collate all the data of what is the supplement herbals that are out there and the evidence behind them, and collate all the research together in one spot. So this is where I started a lot of my research. So if you go out the poster in the hallway, this is basically what all of my research for this year has culminated into. So at the top, I just chose, common palliative care medications we prescribe: Ativan, Haldol, gabapentin, morphine, and Zofran. And then what I've been, based on phone calls to the community, I split it into the top 5 over here as vitamins and supplements. The middle would be your cannabidiols, marijuana, and marijuana whole plant. And then the last would be plant-based supplements. And so there is a lot of other data out there, but these are the top usages of what I found the community is using. So basically how to use this chart is if we start with coenzyme Q10 and Ativan, I did not find any interaction, so that's why that box is blank. But when I did find an interaction, I color-coded those boxes to light blue, moderate blue, and a dark blue down below. The dark blue is a major do not take this combination together, so these dark blues down here. moderate to be cautious with this combination, minor, be watchful as combination, and then a blank is no information. So say, for example, I start with magnesium and gabapentin, it's a light blue, that's a minor, be watchful as combination. I also put on this chart the data behind it in a very easy A through E manner of what is the data behind these interactions. So A through E, A being a high quality randomized clinical trial or a meta-analysis, B being a non-randomized clinical trial, non-quantitative systematic review, C being consensus or expert opinion, D being anecdotal evidence, in vitro or animal study, theoretical based on pharmacology, and it kind of goes in that grade manner. So based on this, what I found is a lot of B's and D's. I did not find A, meta-analysis, non-randomized clinical trial information on these interactions. Okay, so that's the summary, and then I broke it down for this presentation into each section. So starting with the vitamins and supplements, if I go across the board, coenzyme Q10 was a very popular vitamin supplement, but I did not find any drug-drug interactions with that one. Magnesium was a little surprising to me. It had a minor interaction with gabapentin right here with grade B evidence behind it. So clinical research shows that giving magnesium along with gabapentin decreases gabapentin maximum concentration by 33%. So it's just something to think about, and that's why it's a minor interaction. So I go to the next line, melatonin had some moderate interactions as well as some minor interactions with the data behind it. So if we start with melatonin and gabapentin here, it's a moderate interaction with grade B evidence. So melatonin, there's some research stating that melatonin may increase the frequency of seizures in certain patients, particularly children. And theoretically, melatonin may inhibit the effects of these anticonvulsants in these children. So that's why it's a moderate interaction rather than minor. And there's a grade B evidence behind that. Melatonin and benzodiazepines. So melatonin and Ativan right here, moderate interaction. So apparently benzodiazepines inhibit the synthesis of melatonin. And so therefore, chronic benzodiazepine administration may decrease the endogenous melatonin levels. So that would also be, the papers consider a moderate interactions. The rest of them behind, Haldol, morphine, and Zofran would be mild with melatonin. And that's because melatonin inhibits cytochrome P450, 2D6. So theoretically, that interaction may increase this serum levels of Haldol, Zofran, and morphine. Is everyone following what I'm talking about? Okay. All right, probiotics was next. I didn't find any interactions there. And then vitamin D actually was surprising to me. I found moderate interactions with vitamin D and Haldol and Zofran. And that was because, let's see, medications metabolized by cytochrome P450, vitamin D is thought to induce that enzyme, reducing the bioavailability of those substrates, which means it reduces the serum levels of Haldol, Zofran, and morphine. I'm sorry, of just the Haldol and Zofran. So that was the vitamin supplement information I got. And so I know this next section is going to be a big section that a lot of people want to talk about. I can't talk about everything as far as marijuana that's going on inside the California state, but the basic information I can do. So I split it into basically cannabidiol, CBD, THC, CBD and THC being the cannabinoids, the active substrates of the marijuana, and THC being the sedative psychoactive component of that. Research is not so far is pretty basic so far, what we're trying to figure out what cannabinoids do. So in finding research that splits CBD to THC, that was hard to find. And then there was research into marijuana whole plant. So across the board, pretty much, there was moderate interactions with a lot of the medications, which grade D evidence, which means anecdotal evidence in vitro or animal studies or theoretical based on pharmacology. So the research behind that says that high dose cannabidiols, mostly THC, has sedative and hypnotic effects. So combining that with medications that have sedative and anesthetic effects can have an additive therapeutic as well as adverse effects. So if we're going to use these medications along with Ativan, gabapentin, and morphine, that can have an additive effect. And then so the cannabidiols with the Haldol and Zofran specifically, in vitro research shows that cannabidiol inhibits cytochrome P450 1A2, but this interaction is not yet found in humans, so that's why it's still a grade D evidence. But the concomitant use, theoretically, concomitant use of cannabidiols with that substrate may increase the risk of adverse effects from those substrates. So that's where we are so far, and I'm sure all this research that I'm kind of finding will be vetted out more clearly in the future as we go along with that. Okay, the last section I did was plant or fungi based. Ashwagandha I found in the community is an up-and-coming medication a lot of people are using. I think in the past there seems to be hot herbals people were using, like St. John's wort, and then there was like ginkgo biloba, but right now it seems to be ashwagandha, which is actually a root, is used in Indian Ayurvedic medicine. Used as an anti-inflammatory for arthritis and anxiety, also used as a general tonic for daily stress. So across the board, so ashwagandha had some moderate interactions with the Ativan, gabapentin, and morphine with grade D evidence. And that was because, let's see. So let's start with the Ativan and ashwagandha. So theoretically, ashwagandha might increase the effects of benzodiazepine. So ashwagandha and Ativan may increase the effects of the Ativan. And then ashwagandha and other CNS suppressants like gabapentin and morphine, theoretically also having a sedative effect, may potentiate the effects of these sedatives and anxiolytics. So elderberry, if we go on to the next one, had a minor interaction with Haldol and Zofran, grade D evidence. So research shows that elderberry inhibits CYP3A4. There is other research that elderberry alone does not affect that enzyme. It may be used with echinacea affecting that enzyme. So there's still unclear research with elderberry affecting this enzyme. But until more is known, using medications like Haldol and Zofran that affect that same enzyme, we should be a little cautious of. So that's why it's a minor interaction in light blue. Flaxseed across the board is a moderate interaction because it's a bulk forming laxative and may decrease the absorption of all these medications. So that's why I put it as a moderate interaction with grade D evidence. Green tea and Haldol had a minor interaction, and this is from in vitro and in vivo research, that it inhibits intestinal cytochrome P453A, but it's unlikely to be clinically significant as this green tea does not appear to affect this enzyme activity in humans. So that's why I put it as light blue. And then we get to the big one of St. John's wort. Used to be, in the community as this kind of cure-all. And it has, research has shown it has major interactions with Haldol, morphine, and Zofran. So out of anything I've learned from this research is that if I come across a patient with St. John's wort, I'm going to be a little leery of mixing them with some palliative medications. So that's because St. John's wort induces cytochrome P453A4, also induces something called P-glycoprotein, which is a carrier mechanism responsible for transporting drugs across cell membranes. And so St. John's wort can actually prevent absorption of some of these medications across the cell membrane and actually decrease entry of these drugs into the central nervous system. On the side note of St. John's wort, I know these are just the palliative medications I ran interactions on, but St. John's wort had interactions with a variety of medications, primary care, oncological medications. So just to list a few of them was your PPIs, your heart medications for HIV, your atypical antipsychotics, your oral diabetic medications, ibuprofen, losartan, phenytoin, warfarin, fentanyl, Allegra, and it goes on and on and on with St. John's wort. So I guess for anybody out there, I would just be very kind of cautious of that one. And then the last one I found interesting was turmeric is a very popular use. Moderate interaction with Haldol, minor interaction with morphine, moderate interaction with Zofran. Let's see, so let's start with turmeric and Haldol. Moderate interaction is because turmeric inhibits cytochrome P453A4. So there was a case report where they had a transplant patient who was using tacrolimus, which is an immune suppressant for his kidney transplant. He had toxic levels of tacrolimus, and the reason why I'm bringing that up is because tacrolimus is metabolized the same fashion as Haldol. And so he had toxic levels of tacrolimus, and if they found out that 10 days prior to presenting to the ER, he had started to consume turmeric powder, 15 or more spoonfuls per day. And so theoretically, because Haldol is metabolized the same fashion as the tacrolimus, there could be a moderate interaction with haldol and turmeric. So with any medication, if you're going to use, any medicine, being medicine, can still be a toxic agent if used too much. So, and then if we talk about turmeric and morphine, actually, you know what? Haldol and Zofran go together. I'm sorry. Haldol and Zofran go together because Zofran is also metabolized like the tacrolimus. Yeah. Cooking with it in regular form seems to be okay. So he was taking, just orally, apparently taking 15 or more spoonfuls per day. Yeah. So I would think sprinkling it into some, coconut milk, how people use it, or they sprinkle it into food. I mean, we have, a billion plus population in India that uses turmeric daily, so they're fine. So I think in, again, moderate levels, medicate this is perfectly fine. But this man, in trying to treat his disease with the intent of getting better, had caused toxic levels. And then the last one I found was turmeric and morphine, which is a minor interaction in vitro and animal research. Like St. John's wort, inhibits the P-glycoprotein expression activity, so therefore can affect or theoretically affect the absorption of morphine. Okay, and that's pretty much everything. I try to make it super quick. Any questions I can, answer in more in depth, and then the poster is outside on the wall.